In this video, I will discuss necrotizing fasciitis. Here you can see necrotizing fasciitis. There is involvement of the skin and subcutaneous tissue mostly, but here you can see underlying tissues like muscle and fascia are also involved. So patient presents to you with sudden rapidly progressing soft tissue infection, and there is severe pain that is out of proportion to the physical appearance of the infection. The patient has erythema at the site of infection, edema, and there is shiny tense skin. It is a surgical emergency. You should remember it is a surgical emergency and you don't have time to delay its treatment. It has rapid progression. It leads to systemic toxicity very early, leading to multi-organ failure and sepsis and septic shock. Septic shock. So you have to act faster. There may be blisters or bullae appearance, and there may be necrosis of the underlying structures. In case of later stages, there is skin anesthesia. That is, you can't feel anything on the skin. Your skin becomes numb. When there is especially necrotizing fasciitis caused by Clostridium perfringens, then it has crepitus. That is, gas is formed under the soft tissue. There is risk of septic shock and multi-organ failure, as I have told you. Diagnosis. You have to make the diagnosis clinically and immediately because you don't have any time. It is a surgical emergency. Imaging should only be done if the patient is stable. Here you can see on X-ray here, this is air present. This is air. CT and MRI can be done to check for facial edema and gas and fluid tracking. Definitive diagnosis can be done through surgical exploration, and it is gold standard because you don't have any time to wait for labs. Blood cultures can be sent after the surgical debridement, and tissue biopsy can also be sent after surgical debridement. Emergency management. Do not delay for investigations. You have to deal it like a surgical emergency. First, you have to resuscitate the patient. If the patient is hypotensive, you have to give IV fluids. You should give oxygen and you have to monitor the vitals. Second thing is immediate broad spectrum antibiotics should be started immediately. These antibiotics include carbapenem and piperacillin tazobactam and also clindamycin. So this combination comes in the antibiotic tazocin. Tazocin is given along with clindamycin. So these are broad spectrum antibiotics that are given for the infection of necrotizing fasciitis. Vancomycin or linezolid can also be used, especially if you are suspecting methicillin resistant Staphylococcus aureus, but this combination is mostly sufficient. Urgent surgical debridement should be done, and it is the main treatment because it is a surgical emergency. So you have to go for surgical debridement as soon as possible. You have to make wide excision of necrotic fascia and tissue. Sometimes repeat surgeries may be needed after 48 hours if the condition does not improve. Supportive care, like if the patient is diabetic, you have to maintain a tight glucose control and admit the patients in ICU if they have severe infection and septic shock. And in case of streptococcal toxic shock, you can give IVIG. And hyperbaric oxygen therapy, if there are especially anaerobic infection, you should go for this hyperbaric oxygen therapy, but it is only an adjunct. Main thing is you have to go for surgical debridement. It is the main treatment.